Hello everyone, my name is Adilomar Soren Hernandez and today we'll be talking about medication counseling by a pharmacist teaching patients for a better health. Did you know that patients visit their pharmacist 9 times more often than their primary doctors in a year? Many patients don't know how to take their medicines correctly, and this leads to bad use of the treatment, health issues, and extreme cases lead to death. To be able to talk about this topic, I did an extensive research. As a student who has shadowed community pharmacists, I looked for studies and scientific research to highlight how critical medication counseling is for an effective treatment. That is why today I will be informing you of the risk that patients are exposed to when not receiving medication counseling and how a pharmacist helps to avoid this risk for the patient. The first point I will discuss is the common problems that can arise if a patient doesn't receive proper medication counseling. Many patients don't know the purpose, the dose, or the side effects their medication can have. This leads to tons of medication errors. To fully understand the effects of the situation, we should know the process that a patient goes through to receive his medicine. First, the patient visits their primary doctor. Then, the patient receives the prescription and visits the pharmacy. Then, the pharmacy processes the prescription, and finally, the patient receives the medication. Between these processes, the patient passes through the hands of different healthcare professionals. But for this presentation, we will focus on the last point. A list of common risks of not giving counseling are taking medications at the wrong time. If a patient needs to take the medicine strictly at a certain time, for example, 3 times a day or every 8 hours, and the patient is not aware of this specification, it can interrupt or alter the treatment. Mixing medication with other drugs or alcoholic drinks. If the patient has limitations to read or see well, can forget about what the medicine label indicates, leading to ineffective or worse secondary effects. Stopping medications prematurely could lead to a worse illness. For example, if a patient has a bacterial infection and is taking antibiotics, after a few days the patient can feel better and decide not to finish the treatment. This could lead to a worse infection because the bacteria can create resistance against the medicine. And the last point, avoiding self-medication. According to Wasafi, Shields, Huggins, and McElney, the majority of diseases are treated with over-the-counter medications, which do not need a medication consultation. Still, many patients have taken the route of self-medication due to this, and this possesses a great risk since the patient's life is exposed to danger if they do not know the details or the purpose of the medication. We have to remember that medicines are chemical compounds that must be treated with caution. So, with all this risk, who is there to help us? The second point I will discuss is how pharmacists can help avoid this risk for the patient. Everyone has been a patient in their life, but there is a need to have an open interaction with your pharmacist so that more than having a successful treatment, trust can be developed. These are some of the actions that a pharmacist should take to help the patient according to the American Society Health Systems Pharmacist. Orientating patients about their treatment. This point repeats constantly but is the crucial point between a successful treatment or not. Explaining the possible secondary effects of the medication. This could be challenging, but the patient by law has the right to be informed about every detail of the medicine they are taking. Listen to the concerns and doubts of the patient. This is as important as any other point because here is where the pharmacist builds confidence and trust in the patient. And last point, not letting the patient go with questions about their treatment. No matter how much work could be presenting the pharmacist at the moment, every patient must live completely clear about their treatment. Here are some statistics about the satisfaction of patients with pharmacy services. These show that a majority of patients are satisfied with the pharmacy for services. This reflects that both pharmacists and other health professionals are committed to providing a quality service, and in turn, this is reflected in the patients who carry out their treatment correctly. With all the gathered information, we can see the importance of receiving medication counseling and how a pharmacist is involved in helping the patient. We discussed the possible risk a patient can be exposed to when not receiving a proper medication counseling from their pharmacist and the way that this health provider helps the patient avoid all this risk. With all being said, I wanted to end this presentation with a quote that says, "Pharmacy is not just about pharmaceuticals, it is about people." For any questions or concerns about medication counseling, you could contact the American Pharmacists Association website, which is linked to this presentation. Here are the references, and thanks for your attention.